7 reasons why you cannot, and I mean cannot, go to the pharmacy when something or somebody hits your eyes. You may need to strap your seatbelt on for this one because it's very relatable, but it's about to get really messy. Let's get into it. Welcome once again to I Matter with Dr. S. Today we're going to be talking about trauma to the eyes. To start up with the lighter notes, as an African child with an African mother, 3 out of 5 times, chances are very high that you have received slaps to your face, including your eyes. Sometimes we get off lucky, but this innocent act of trying to discipline your child can cost your child his or her vision for life. Trauma cases are much more prevalent in children because they live a very carefree lifestyle. They're still exploring things, and a lot of times they do not think about consequences before indulging in acts. Trauma cases are also very common amongst males in general because they indulge more in fighting, amongst occupation like welders, carpenters, amongst people that are victims of domestic violence. And it just could be life. Life happens sometimes. So let's get into 7 things that can happen when something or somebody hits your eyes. The first one is called corneal laceration. Very common in children, carpenters, welders. Cornea is a soft rubber gel-like structure in front of our eyes. It is the one that protects and covers that colored part of our eyes, and it contributes significantly to vision. The child just rushes into the kitchen while you're cooking as a mom and says, "Oh, mommy, I just hit my eye on something." Or he comes back from school and says, "Oh, me and my classmates were playing and he mistakenly put pencil in my eye." Or I was playing outside with my friend with a broom or stick and it mistakenly entered my eyes. You look at your child's eye, it's red. In this situation, the moms do one of 2 things. It's either she observes the child, see if the redness and pain goes, or she goes to a nearby pharmacy where they give her eye drops that can help with the redness and pain. Unfortunately, the pharmacy does not have a slit lamp, which is our microscope that we usually use to examine cases of trauma. Once your child complains that something hits their eyes, the next step is to take that child to the hospital. Just last week, I saw a child who was playing with sticks with his younger brother outside and sustained a corneal laceration. Mother first went to the pharmacy, and when she realized it wasn't getting better, after about 3 days, she went to an eye clinic where they saw that it was a corneal laceration and finally referred her to the ophthalmologist. This is what the child's corneal laceration looked like. Almost the entire width of the eye was torn and it was repaired, the simulation of which I showed in my page. A corneal laceration is an emergency to us ophthalmologists. The earlier you present, the better the outcomes. Another thing that can happen is that the frontal part of the eye can be filled with blood. It's called a hyphema. When this happens, it can increase the pressure in your eyes and it can also affect vision. The third thing that can happen is that the drainage system of the water in the eyes, if you watch my video on glaucoma, you can see that I said that the eyes have water that drain into a drainage system. Those drainage systems can be clogged by the trauma, and because of that, water will not be able to flow well and the person will finally develop glaucoma. It will compress the optic nerve of that person, and that person is going to lose vision in that eye permanently. Why? Because once the optic nerve is damaged, it cannot be repaired. The fourth thing that can happen is that that colored part of your eyes, it can be brown, it can be hazel, blue, green, depending on your race, called the iris. That part has muscles that contract and relax to control the amount of light that enters into our eyes. But in some cases of trauma, the muscles will be permanently damaged. They cannot contract or relax based on light entry. And what that means is that the person will be having photophobia, which is so much discomfort and pain when light enters their eyes for life, which is a very uncomfortable situation. They could also develop cataract, and then the person will not be able to see clearly. They may not develop it immediately, but they may develop it at a later time. This is why when we see trauma patients, we give them close appointment just to monitor them over the next 3 months, after which we monitor them 6 monthly and then yearly, because they can develop any of these late-term complications, including cataract and glaucoma. Another thing that can happen is that blood will pour at the back of your eye. If you watched my video on floaters, I explained in detail what we call the vitreous gel. So blood would fill that vitreous gel because of the trauma, and it will affect the person's vision. These patients would have floaters. This patient will have flashes of light. If it is a lot of bleeding, may end up requiring surgery. And then the 7th reason is that the person can have a retinal detachment. Retina is the inner lining of your eyes. This is also an emergency. Retinal detachment requires surgery straight up, and the surgeries are very expensive, starting from 2 million naira and above. And the outcome, once again, depends on when you presented to the hospital. So all these reasons are enough to tell you that you cannot go to the pharmacy. So the take home of this video, number 1, let's avoid beating our children on their faces, both parents at home and teachers in school. Secondly, if your work requires handling metals, nails, iron, please always wear protective eyewear at work, because I have seen so many carpenters, welders, especially with corneal laceration. A fist blow to the eye in case of fighting or domestic violence may not really give you corneal laceration, but it may give you all the other consequences of trauma. And so once you sustain any trauma, no matter how small you think it is, the next best step is to go to an eye clinic to get yourself examined. All these may sound like fancy things from a textbook, but these are people's lives ruined forever. People losing their vision due to avoidable mistakes or just ignorance on what exactly they should have done and when to act. I hope this video has been helpful, and I'll be seeing you in my next episode. Thank you for sticking to the end.